As we grow older, our bodies change in subtle but significant ways. By the time we reach 70 and beyond, the wisdom of years is often accompanied by the reality that not every medical test is as beneficial as it might have been in our younger years. In fact, some tests that are routine for younger adults can pose unnecessary risks or create more stress than reassurance for those of us in the golden decades of life. It's important to remember that medical care is not one size fits all. Our bodies become more delicate, our organs less resilient, and our responses to procedures, medications, and diagnostic interventions can differ dramatically from what they were at 50 or 60. Understanding which tests offer true benefits and which might introduce risk is a step toward protecting our health, maintaining independence, and reducing worry. Many older adults feel obligated to undergo every screening and lab tests recommended in general guidelines, but the reality is that the benefits of some procedures decrease with age, while the potential for complications increases. This doesn't mean ignoring your health, quite the opposite. It's about smart, informed choices that honor your body, your experience, and your peace of mind. For people over 70, certain tests carry a higher chance of harm. These include invasive procedures that stress the heart or kidneys, screenings that might lead to unnecessary interventions, and routine labs that may detect minor irregularities that don't require treatment. Even something as simple as a blood test can sometimes lead to follow-up procedures or medications that may not truly improve your quality of life. In this discussion, we're going to explore a comprehensive list of medical tests and screenings that often require a second thought for anyone over 70. We'll examine why these procedures might not always be helpful, the potential risks involved, and the ways you can work with your healthcare provider to make informed choices. Our goal is not to alarm but to empower, to give you the knowledge to protect your health, make your time in the doctor's office purposeful, and avoid unnecessary stress. Imagine having the confidence to know which tests are truly necessary and which ones you can skip or delay, all while maintaining your health and independence. This is about reclaiming control over your healthcare decisions and ensuring that every procedure you undergo is meaningful and beneficial. Before we dive in, let me ask you, have you ever felt unsure about which medical tests are really necessary as we age? Drop a quick comment below that says Health Smart if you want to make the best choices for your health. And if you haven't yet, hit subscribe to Senior Longevity Tips, where we share daily tips to help older adults stay informed, healthy, and confident in their care decisions. Let's begin with one of the most common screenings that many older adults encounter: mammograms. For women over 70, routine mammography may not always provide the benefits it once did in younger years. While early detection of breast cancer can be life-saving for some, the reality is that in older adults, tumors often grow more slowly and may not pose an immediate threat to health. The risks of unnecessary mammograms include false positives, which can trigger additional tests, biopsies, and emotional stress. Each follow-up procedure carries its own potential for complications, minor bleeding, infection, or even procedural discomfort. For many women in their 70s, the cumulative effect of repeated testing can outweigh the potential benefits, especially if they have other chronic conditions or limited life expectancy. It's not about avoiding care, it's about choosing wisely. If you have a strong family history of aggressive breast cancer, your doctor might still recommend mammograms. However, for many women, skipping routine screenings after 70 may reduce stress and the risk of unnecessary interventions without compromising overall health. Next, consider Pap smears, which screen for cervical cancer. After 70, most women do not need this test if they have had regular normal results in the past. Cervical cancer risk declines significantly with age, and ongoing Pap tests can often create false alarms that lead to additional procedures, discomfort, and anxiety. Another frequently discussed test is the PSA, prostate-specific antigen, test for men. While PSA screening can detect prostate cancer early, it's important to know that many prostate tumors in men over 70 grow very slowly and may never become life-threatening. Detecting these cancers can lead to treatments such as surgery or radiation that carry serious side effects, including incontinence, erectile dysfunction, and other complications. For many older men, avoiding routine PSA tests may actually improve quality of life without reducing longevity. Even blood tests that seem harmless can sometimes backfire. Routine labs without specific medical indications can identify minor irregularities that are unlikely to affect health but may trigger a cascade of additional tests, medications, and worry. Every extra procedure or medication adds a small but cumulative risk, stress on the kidneys, liver, or cardiovascular system, and can affect your overall well-being. Understanding these nuances is key. The goal is not to avoid healthcare entirely but to focus on meaningful, safe, and beneficial tests. By prioritizing procedures based on your age, health status, and life goals, you can reduce unnecessary risks and preserve your energy, confidence, and peace of mind. One of the most common screenings recommended for adults is the colonoscopy, used to detect colon cancer and polyps. While colonoscopies can be life-saving for some, for people over 70, the procedure carries real risks that must be carefully considered. In older adults, the sedation and anesthesia required for the test can stress the heart and lungs. There's also a risk of perforation or bleeding in the colon, which may require hospitalization or surgery. For many seniors, especially those with chronic health conditions like heart disease, diabetes, or kidney problems, the potential complications can outweigh the benefits. If your previous colonoscopies have been normal, or if you have limited life expectancy, it may make sense to discuss postponing or skipping routine colonoscopy screenings. Less invasive options, like stool-based tests, may provide safer alternatives without sacrificing peace of mind. Other invasive procedures also carry heightened risks with age. Endoscopies, angiographies, and biopsies can strain the body and sometimes trigger infections or slow recovery. Older adults heal more slowly, and even minor complications can become significant. It's essential to weigh whether the information gained from a test will actually change your medical care in a meaningful way. Even routine imaging tests, such as CT scans or MRIs with contrast, deserve caution. The contrast dyes can affect kidney function, especially in older adults who already have mild kidney impairment. Frequent imaging can also increase exposure to radiation, which may add risk over time. These procedures are best reserved for situations where the results will directly guide treatment or significantly improve health outcomes. Sometimes, the safest choice is personalized care. By discussing your health history, current conditions, and life priorities with your doctor, you can decide which screenings are truly necessary. Remember, avoiding unnecessary tests isn't neglect, it's protecting your body, energy, and mental well-being. Medical care should empower you, not overwhelm you. Each decision to undergo a test should be informed, intentional, and aligned with your goals for comfort, safety, and quality of life. By understanding the risks of invasive procedures and prioritizing what truly matters, older adults can maintain control over their health while avoiding unnecessary stress or harm. Routine laboratory tests are often seen as harmless, but for people over 70, they can sometimes create unnecessary worry or lead to interventions that offer little real benefit. Blood tests for cholesterol, thyroid function, or vitamin levels can detect minor irregularities that may not require treatment at all. These results can trigger additional tests, medications, or lifestyle restrictions that may not improve health and can sometimes even stress the body unnecessarily. For instance, slightly elevated cholesterol or mild thyroid changes are common in older adults and often do not need aggressive treatment. Yet discovering these minor deviations can lead to a cascade of medications, dietary changes, and repeated lab checks, each of which carries its own risks and can impact quality of life. The goal should be to focus on tests that provide meaningful insights for improving health outcomes, not just generating data. When it comes to the heart, some common cardiovascular tests can also be risky or unnecessary. Stress tests, echocardiograms, and routine coronary screenings may put physical strain on the body, especially in people with known heart disease, high blood pressure, or other chronic conditions. While these tests can detect serious issues, they are only truly useful when results will lead to interventions that improve safety or quality of life. Even blood pressure and ECG monitoring, while generally safe, can sometimes lead to overdiagnosis and overtreatment in older adults. Overzealous medication adjustments based on minor variations can produce side effects such as dizziness, falls, or fatigue. In older adults, these small imbalances can quickly become significant, impacting independence and well-being. Other screenings, like DEXA scans for bone density, are important for some older adults, but repeating them too frequently may not provide additional value, especially if a diagnosis has already been made and treatment is underway. The key is personalized care, focusing on tests that matter for your health goals and avoiding those that introduce unnecessary risk. Ultimately, every test should be considered not just for what it can detect, but for how the results will improve your life. By working closely with a trusted healthcare provider, you can avoid unnecessary procedures and focus on tests that truly support your independence, comfort, and overall quality of life. Cancer screenings are often emphasized as essential for adults of all ages, but as we age, the balance between benefit and risk shifts. For people over 70, certain routine screenings may offer limited advantage while introducing real risks. Understanding these nuances can help older adults make informed choices. Mammograms are a prime example. While early detection of breast cancer is life-saving in younger women, many tumors in older adults grow slowly and may never threaten overall health. Routine mammograms can lead to false positives, causing emotional stress, additional imaging, or even biopsies that carry minor risks of bleeding or infection. For women with a history of consistently normal results and no symptoms, skipping routine mammograms after 70 may reduce stress and potential harm. Pap smears follow a similar pattern. Cervical cancer risk declines significantly with age, and for women who have had regular negative results in the past, ongoing screening often provides little benefit. Yet false positives can prompt unnecessary procedures that are uncomfortable and anxiety-inducing. Men face their own dilemmas with PSA, prostate-specific antigen, testing. PSA screenings can detect prostate cancer early, but in men over 70, many detected cancers grow so slowly they are unlikely to cause problems. Aggressive interventions, such as surgery or radiation, carry risks like incontinence, sexual dysfunction, and other complications. Deciding against routine PSA testing may help maintain quality of life without compromising health. Other cancer screenings, including colorectal imaging or endoscopic evaluations, must also be evaluated carefully. While detecting polyps or early-stage cancers is valuable, the invasiveness of these procedures carries increased risk in older adults: anesthesia complications, bleeding, or perforation of internal organs. Less invasive alternatives, like stool-based tests, may provide safer options without sacrificing early detection. The overarching principle is this: screenings should be targeted, purposeful, and aligned with your health priorities. Not every routine test is essential after 70, and making thoughtful choices can protect your body, reduce anxiety, and preserve energy for the aspects of life that bring joy and meaning. By approaching cancer screenings with discernment, and in consultation with your healthcare provider, you can maintain vigilance while minimizing risk. The goal is not avoidance, but smart, informed, and safe health care that prioritizes your well-being, independence, and peace of mind. Invasive procedures and imaging tests that involve contrast agents are often considered routine, but for people over 70, they can present real risks. As our organs age, they become more sensitive to stress, and procedures that were once low risk may now carry significant potential for complications. Colonoscopy, for example, while valuable for detecting colon cancer, involves sedation and anesthesia that can strain the heart and lungs in older adults. There's also a risk of perforation or bleeding, which may require hospitalization or even surgery. These risks are particularly concerning for people with chronic conditions such as heart disease, diabetes, or kidney problems. Endoscopies for the digestive tract are another category where caution is warranted. These procedures can detect problems early, but they are invasive, sometimes uncomfortable, and may result in minor complications like bleeding or infection. In older adults, recovery can take longer, and even minor issues can significantly affect quality of life. Imaging tests using contrast, such as CT scans or MRIs with dye, are widely used for diagnostic purposes. However, the contrast agents can affect kidney function, which naturally declines with age. For seniors with pre-existing kidney concerns, this may lead to temporary or lasting kidney injury. Repeated scans also expose the body to cumulative radiation, which should be considered when planning routine screenings. Angiography and other vascular imaging studies, while informative, carry risks of blood vessel injury or reaction to contrast material. In older adults, the benefits of discovering minor vascular issues must be weighed against potential complications from the procedure itself. The key takeaway is that every invasive or contrast-based test should be carefully considered, particularly after age 70. The benefits must clearly outweigh the risks, and alternative, less invasive approaches should always be explored first. Ultimately, the goal is to make informed decisions about medical procedures, focusing on interventions that genuinely improve health, prevent serious complications, or enhance quality of life, while avoiding those that may inadvertently cause harm. With thoughtful planning and open dialogue with your healthcare provider, older adults can maintain safety, confidence, and peace of mind in their medical care. Routine laboratory tests may seem harmless, but in people over 70, they can sometimes lead to unnecessary interventions, stress, and side effects. Blood tests for cholesterol, thyroid function, liver and kidney markers, or vitamin levels are often performed without specific symptoms. While these tests can provide useful information, they may also detect minor deviations that do not require treatment, yet trigger a cascade of further testing and medication. For instance, a slightly elevated cholesterol level or a minor thyroid imbalance can result in new prescriptions, repeated lab tests, and lifestyle restrictions. Each step, while intended to improve health, can inadvertently stress the body, affect energy levels, or lead to side effects from medications. In older adults, even small complications can have a significant impact on independence and well-being. Blood pressure and heart rhythm monitoring, though generally safe, can also become a source of overdiagnosis. Minor fluctuations may prompt medication adjustments that lead to dizziness, falls, or fatigue, all of which are particularly risky in older adults. Maintaining balance is key. It's better to focus on meaningful tests that inform treatment decisions, rather than chasing every small lab variation. Bone density scans, like DEXA, are helpful for diagnosing osteoporosis, but repeating them too frequently may provide limited additional value, especially if a diagnosis is already established and treatment has begun. The main focus should be on tests that will directly impact your health and quality of life. The principle is clear: tests should serve you, not stress you. Each blood draw or imaging study should have a clear purpose, contributing to decisions that enhance health, prevent complications, or improve comfort and independence. Working with a knowledgeable healthcare provider, you can choose which routine tests truly matter and which may safely be postponed or avoided, preserving your energy and peace of mind. By thoughtfully considering the necessity of routine labs, older adults can maintain control over their health care, reduce unnecessary stress, and ensure that every medical intervention adds real value to their life. Cardiovascular tests are crucial for detecting heart disease, but in people over 70, some routine screenings may carry risks or offer limited benefits. Stress tests, echocardiograms, and routine coronary screenings can be physically demanding and, in certain cases, may lead to complications such as irregular heart rhythms, chest discomfort, or blood pressure fluctuations. For older adults with pre-existing heart conditions, the stress from these tests can outweigh the potential advantages. Even when results reveal abnormalities, the treatment options may not necessarily improve longevity or quality of life, especially for minor findings that do not affect daily function. Similarly, routine electrocardiograms, ECGs, and blood pressure monitoring, while generally safe, can sometimes prompt overdiagnosis and overtreatment. Medications adjusted based on minor fluctuations may cause dizziness, fatigue, or increase fall risk, side effects that can significantly impact independence in older adults. Other cardiovascular procedures, like angiography or CT scans of the heart, involve contrast agents or radiation, which may stress the kidneys and increase cumulative exposure. These tests should be reserved for situations where results will directly guide treatment decisions or prevent major cardiovascular events. Even widely recommended screenings, such as checking for abdominal aortic aneurysm, need to be considered individually. While early detection can be life-saving, the benefit may be limited if chronic health conditions or frailty reduce the potential for surgical intervention. The key principle for older adults is to focus on tests that truly change management. Every cardiovascular screening should be evaluated based on personal health, life expectancy, and overall quality of life. Tests are most valuable when they prevent serious complications, guide meaningful treatment, or provide reassurance without causing undue stress or harm. By carefully considering each cardiovascular test and discussing individual risks and benefits with a trusted healthcare provider, older adults can maintain their heart health safely, avoiding unnecessary procedures while preserving energy, independence, and peace of mind. Beyond heart and cancer screenings, there are other common tests that people over 70 should approach with caution. Routine imaging, extensive blood panels, and certain sensory screenings can sometimes provide more stress than benefit if the results do not meaningfully change treatment. For example, CT or MRI scans of the brain, often used to detect minor cognitive changes, can sometimes lead to findings that are clinically insignificant but provoke worry or unnecessary follow-up procedures. Older adults may be diagnosed with abnormalities that will never impact daily life, yet the cascade of additional testing can create anxiety and expose the body to contrast agents or repeated imaging. DEXA scans for bone density are vital for osteoporosis management, but frequent repeat scans may not provide additional useful information once a diagnosis is established and treatment has started. The goals should be to monitor progress as needed, without excessive repetition that could lead to unnecessary concern or interventions. Eye and hearing screenings are generally safe, but in some cases, overtesting can lead to recommendations for procedures or devices that may not substantially improve quality of life. For example, aggressive surgical interventions for mild eye conditions may carry more risk than benefit in older adults. Even commonly recommended metabolic panels, including tests for glucose, kidney, and liver function, may reveal minor fluctuations that do not require treatment but can prompt additional labs, consultations, or medications. These alert signals often add stress without improving health outcomes. The overarching lesson is clear: every test should have a purpose. Before undergoing any screening, older adults should ask, "Will this result change what I do? Will it improve my health, safety, or comfort?" If the answer is uncertain, it's worth discussing alternatives or delaying the test. Empowered with knowledge, older adults can prioritize the screenings that matter most, those that protect health, enhance independence, and improve quality of life, while avoiding unnecessary procedures that add risk, stress, and burden. Approaching medical tests after the age of 70 requires thoughtfulness, self-awareness, and collaboration with your healthcare provider. The goal is not to avoid care but to focus on screenings and procedures that truly support your health, independence, and peace of mind. Start by considering your personal health priorities. What matters most to you: maintaining mobility, protecting heart health, managing chronic conditions, or simply feeling confident in your day-to-day life? By clarifying your goals, you can make informed decisions about which tests are essential and which may be safely postponed or skipped. Next, discuss each recommended test with your doctor. Ask questions like, will the results change my treatment plan? What are the potential risks, especially at my age? Are there safer, less invasive alternatives? This approach transforms medical care from a routine checklist into a personalized, intentional plan. It ensures that each test serves a meaningful purpose, rather than simply following generalized guidelines that may no longer apply. Pay attention to how your body reacts to previous procedures. Recovery times lengthen with age, and minor side effects can become significant. For example, an invasive test may result in fatigue, dizziness, or temporary mobility issues. By learning from past experiences, you can make better informed decisions about future screenings. It's also essential to maintain open communication with family or caregivers. Having someone who understands your health history and priorities can help you weigh risks and benefits objectively, and provide support in making decisions that align with your values. Finally, remember that your peace of mind is a critical component of health. Avoiding unnecessary procedures reduces stress, minimizes exposure to potential complications, and allows you to focus your energy on activities that bring joy, connection, and purpose. By embracing a thoughtful, informed approach, older adults can navigate medical care with confidence, making choices that protect their bodies, support their independence, and enhance their overall quality of life. Practical strategies can help older adults navigate medical tests safely while preserving their health, energy, and peace of mind. Here are key approaches to make your healthcare experience more empowering. 1. Prioritize necessary tests. Focus on screenings that will meaningfully impact your health or guide treatment decisions. Routine or repeated tests with minimal benefit can often be postponed or skipped. 2. Understand the risks. Every procedure has potential side effects. Knowing what to expect helps you make informed decisions and reduces anxiety. Ask your doctor about the likelihood of complications, recovery times, and alternatives. 3. Prepare your body. For tests that require fasting, sedation, or contrast agents, ensure you are well hydrated, rested, and have a support system in place. Proper preparation can reduce stress on your heart, kidneys, and overall well-being. 4. Track your medical history. Keep a clear record of past tests, results, and procedures. This information allows your doctor to identify patterns, avoid unnecessary repetition, and make better-informed recommendations. 5. Communicate openly. Share your health priorities, concerns, and lifestyle preferences with your healthcare provider. Honest dialogue ensures that medical decisions align with your values, comfort, and long-term goals. 6. Seek second opinions when needed. If a recommended test seems invasive, stressful, or potentially unnecessary, don't hesitate to get another professional perspective. This empowers you to make safer, more confident choices. 7. Focus on holistic health. Beyond medical tests, maintain a balanced lifestyle. Regular physical activity, proper nutrition, hydration, sleep, and social engagement all support your health and reduce the likelihood of serious complications. 8. Manage stress and emotional well-being. Anxiety about medical procedures can impact your physical health. Gentle mindfulness, relaxation exercises, or support from loved ones can make tests less intimidating and promote better recovery. By following these strategies, older adults can approach medical care with confidence, safety, and clarity. Tests become tools for empowerment rather than sources of stress or unnecessary risk. Every choice you make can enhance your quality of life, preserve independence, and ensure that your healthcare truly supports your goals and well-being. As we reach our 70s and beyond, medical care should shift from a routine checklist to a thoughtful, intentional plan that respects our bodies, experiences, and priorities. The tests and screenings you choose to undergo should serve a clear purpose: to improve your health, maintain your independence, and protect your peace of mind. Remember, not every procedure is essential. Some tests, while routine for younger adults, may carry unnecessary risks for older adults. Invasive procedures, repeated imaging, or screenings with limited benefit can introduce stress, complications, and emotional strain. Understanding these nuances allows you to make informed decisions that truly support your well-being. Empower yourself with knowledge, discuss the necessity of each test with your healthcare provider, evaluate potential risks and benefits, and consider alternatives whenever possible. Trust your instincts and your experience. You know your body better than anyone. Prioritizing safety and meaningful care is not neglect, it is wisdom in action. Keep in mind that your overall quality of life matters just as much as longevity. Avoiding unnecessary procedures can reduce stress, preserve energy, and allow you to focus on the activities and connections that bring joy and purpose. Every decision you make about your health is an opportunity to honor your independence, maintain your vitality, and live fully. Let's pause for a moment. Have you ever had a test you later wondered about? Share your experience in the comments. I read every single one, and your insight could help someone else make smarter health decisions. And if these tips are giving you clarity and confidence, give this video a thumbs up. It helps more seniors learn which tests are truly necessary and which might be avoidable. And make sure to subscribe to Senior Longevity Tips. Here you'll find daily guidance to help older adults stay informed, make wise health decisions, and live stronger and healthier every day. Ultimately, the message is simple: approach medical tests with intention, awareness, and confidence. Let your healthcare choices reflect your goals, your comfort, and your desire to protect the life you cherish. By doing so, you can navigate your 70s and beyond with grace, wisdom, and peace of mind, fully in control of your health and your future. Your health is your greatest asset, and every careful, informed choice you make strengthens it. Embrace this approach, and you can confidently face medical care with clarity, empowerment, and serenity, knowing that your body and your life are respected every step of the way. Before we wrap up, I want to thank you for caring about your health, for asking the right questions, and for taking steps to make informed choices. Until next time, stay informed, take care of yourself, and prioritize your well-being.